The anatomy and physiology of skull fractures. A fracture in which the bone breaks cleanly but does not penetrate the skin is a closed fracture. When the broken bone ends penetrate through the skin, the fracture is open. Despite bone's remarkable strength, they are susceptible to fractures or breaks all throughout life. During youth, most fractures result from exceptional trauma that twists or smashes the bone.
The skull is prone to fracture at certain places such as the thin, squamous temporal and parietal bones over the temples, the sphenoid sinus, and the foramen magnum. A linear skull fracture is a break in a cranial bone resembling a thin line without splintering, depression, or distortion of bone. A fracture is greater than 3 millimeters in width and runs through both the outer and inner lamina of bone. A fracture usually runs in a straight line. Remember, a fracture is not a suture. A suture is less than 2 millimeters in width. A suture is very curvaceous and it does not run in a straight line. Temporal bone fractures are encountered in 75% of all skull-base fractures. The three subtypes are longitudinal, transverse, and mixed. The most common type, longitudinal fractures, occur in the temporoparietal region and involve the squamous portion of the temporal bone. Transverse fractures begin at the foramen magnum, ending in the middle cranial fossa. Mixed fractures have elements of both longitudinal and transverse fractures.
Occipital condylar fracture results from a high-energy blunt trauma with axial compression, lateral bending, or rotational injury. The type 3 fracture, and the most harmful, is an avulsion injury as a result of forced rotation and lateral bending. Clivus fractures are described as a result of high-energy impact sustained in motor vehicle accidents. These fractures result from a high-energy direct blow to a small surface area of the skull. Most of the depressed fractures are over the frontoparietal region because the bone is thin and the specific location is prone to an attack. A depressed fracture may be open or closed. Open fractures have either a skin laceration over the fracture or the fracture runs through the paranasal sinuses. Open fractures may either be clean or contaminated. In newborns, ping-pong depressed fractures are secondary to the baby's head impinging against the mother during uterine contractions. The use of forceps also may cause injury to the skull, but this is rare. In addition to the risk of infection in contaminated depressed skull fractures, a risk of developing seizures also exists. Another common fracture is a compression fracture. This is where the bone is crushed. This is most common in osteoporotic bones. This can lead to a condition called cerebral compression. This occurs when there is a buildup of pressure on the brain. This condition usually develops immediately after a head injury.